Well, December 14th, 2014 was a life-changing day for me and my family. I had a routine blood test, and soon after, the doctor's office called and told me to make an immediate appointment at our local cancer center. My wife and I went to the cancer center, and the stranger called an oncologist told me four things. I had an advanced and serious blood cancer called acute myeloid leukemia. I didn't understand any of that. He prescribed 30 to 60 days of treatments called chemotherapy. When I asked the prognosis, what does this mean? He said, go home and get your affairs in order. And then he recommended we get a second opinion in New York City at a bigger facility. Acute is a bad cancer word because it means fast growing. Chemotherapy is the decades-old standard of care. It has harsh side effects, and probably at the time at my age was not a cure, just a treatment. And I interpreted getting my affairs in order comment as a polite phrase that my life expectancy was probably short. Well, I appreciate the doctor's fourth comment and went to New York for a second opinion, met a new oncologist who gave me the same exact prescription, 30 to 60 days of chemo. So we're all set to do that. But on Sunday evening, 12 hours before my chemo was to start, the New York doctor called and said she had done special mutation testing and that I may have a chance to try a clinical trial. I have since learned that clinical trials are only done most of the time after everything else has failed. So here I was facing either chemo or a clinical trial. But I also knew, why would she call if she didn't think it was a good idea? We did not hesitate and chose to do the clinical trial. I was terribly sick, sleeping almost 24 hours a day for 5 months, barely mobile, unable to take in any food, losing 45 pounds and fighting this terrible disease. My AML white blood cells, called blasts, rose to over 70% of my marrow volumes. We battled leukemia, jaundice, infections, rashes, just about everything that could go wrong. My wife Dorcas carried all the physical and so much of the emotional load for over a year. We had no visitors because I was so susceptible to germs. But something was keeping me alive longer than I thought. Waking up every morning was a pleasant surprise, and after 5 months, the drug trial was making my bad leukemia cells disappear and leaving room for healthy blood cells. What a thrill seeing the blasts go down. AML is a life-changing experience, but here I am 9 years later, maybe providing hope for others. Next slide, please. So how did I feel? Well, the best words I can remember are confusing, in a fog. It's all a mystery. First few months, it's a mystery. Now I know a lot about AML 9 years later, but then it was just, I could not even perceive what it meant for the future of me and my family and friends. We needed to find an AML specialist, which I can recommend to everybody if you have that opportunity, either remotely or locally. It became a life-changing experience, and all the things that you normally do in life are sort of put aside, and you just deal with the AML. It's a huge part of our lives, and it is to this day. Next slide, please. There are so many factors addressing the treatment options. My age, my mutation, the geography. Do you have access to an AML specialist doctor? Do you have access to the testing equipment that can find out what you really need? And the availability of a caregiver, a carer, whether it's short-term or lifelong, it is so critical. And I think one thing I must add is my wife is, we've been married 50 years and she's been caring for me 50 years, but this was a very rough year. And if you have a chance to be lucky enough to have a caregiver, make sure you give that person time off and time for themselves also, because can be a full-time job. Next slide. So you'll hear about more treatments in a few minutes, latest treatments. And in the 9 years that I have AML, the treatments and the medicines and the technology has been incredible. So really, if you get AML and you can be treated to something that might make it go away, get you into remission, that would be the best case. But in my case, I still have it. I get chemo every month. So you really have to plan for it to be a part of your life. It's you have to maintain hope and survival. And if you're lucky enough, as I am, the long-term treatment seems to be still working. Next slide, please. It is personal. It's with you. I feel very fortunate that we're lucky to live in a small town where people understand it. And a lot of people my age have a lot of things going on. So whether or not I've got it for 9 months or 9 years or not, doesn't matter. I'm grateful for every bonus day. And I went through a very tough year. And so the next best thing would be long-term, less intensive treatments in the hospital or orally at home. That would be sort of the golden target. Then quality of life is possible. I once had an oncologist tell me he had only heard of quality of life in the last 10 years, because before that, it was just keeping people alive. Next slide. It's an individual and unique disease. It's dependent on many, many factors: age, location, access to tools and technology. Know AML, the organization in London, is, in the last 7 years, it's a miracle how much information they've been able to discover and share. So people now have a chance, if they know about where to go. All the drug companies have information. So treatments will vary in intensity. I never had a transplant, but I had my clinical trial, which when I hear about transplants and compare it, they're pretty bad, they're pretty hard, but you got to do them. And the options have so much better the last 10 years. Next slide. So every day, AML survival is more possible. I'm grateful for these extra days, all dependent on my caregiver, wife Dorcas, my amazing doctor in New York City, who is an ambassador at Know AML, and all the new medicines that have been invented and approved. So quality of life can be possible. And it's important that every patient establish a system of support. The resources are there. They're in your town, maybe, if you're lucky, but if not, they're available online and remotely. And what I do and what I think everybody might be able to do is, as we get these treatments and we stick around long enough, maybe there'll be a cure. So thank you very much for your time today.